Hi folks, so this is a short series on hypersensitivity reactions. What we'll do is we have 4 short presentations on the different types of hypersensitivity reactions, each based around a case. I have also produced another lecture which I will add to this series, which looks at some specific conditions that you're likely to see in the emergency department that are really immunological considerations and based around this idea of hypersensitivity. But these initial 4 talks are just to introduce you to the different types of hypersensitivity reaction. So you might want to pause the video and just think about how we classify hypersensitivity reactions and maybe some examples of each type. So as you probably are aware, there are 4 types of hypersensitivity reactions, ranging from immediate hypersensitivity mediated by IgE antibodies all the way down to delayed hypersensitivity, which is a cellular response. And in each of our short talks, we'll speak about one of these hypersensitivity reactions. So let's start. Our first case is a 32-year-old female who presents to the emergency department with an itchy rash, which started 2 hours after eating shellfish. Her vital signs are stable and her chest is clear. You should pause the video now and see if you can figure out what's going on with this patient and as much about the pathophysiology, clinical features and treatment as you can remember. Okay, so this is a type 1 hypersensitivity reaction. This is an immediate reaction that involves immunoglobulin E mediated release of antibodies against soluble antigen, which results in mast cell degranulation and the release of histamine and other inflammatory mediators. The type 1 hypersensitivity actually has 2 stages. The initial or sensitization phase occurs with first exposure to the allergen. The allergen at this point is presented to T cells by antigen presenting cells, and the T cells produce IgE, which then adhere to the surface of mast cells and basophils. With a second exposure to the same allergen, these allergens then bind to the IgE antibodies that are already adherent to the surface of the mast cells, cause cross-linkages between IgE antibodies, and then this leads to degranulation of the mast cells with release of various inflammatory mediators, including histamine, bradykinin, and various other inflammatory mediators such as interleukins, tumor necrosis factor, and various cytokines. Treatment is aimed at reversing the effects of immediate hypersensitivity and reducing the inflammatory response. The main effects of the immediate hypersensitivity would include vasodilation and increased capillary permeability, which leads to tissue edema, hypotension, bronchospasm, and airway obstruction. The mainstay of treatment for severe type 1 hypersensitivity or anaphylaxis is the use of epinephrine. So its cardiovascular and respiratory effects would lead to cardiac stimulation and vasoconstriction, raising blood pressure, bronchodilation, and mast cell stabilization. Steroids can stabilize mast cells and also reduce the release of inflammatory mediators. Many of these hypersensitivity reactions have a delayed second phase, and because the steroids have a longer mechanism of action, these can reduce the biphasic reaction. And finally, we can use both H1 and H2 antagonists to block histamine receptors, understanding that histamine is a significant inflammatory mediator in this type of response. So let's just think a little bit about the response itself. That can be divided into two categories. The patient we saw who is basically stable would be considered to have an acute allergic reaction. However, if the effects of the inflammatory response cause any life-threatening problems in any single organ system, that would be seen as a anaphylactic reaction. So if the patient has things like airway obstruction, bronchospasm, or hypotension, then this would be categorized as an anaphylactic reaction. So that's the first of our very short talks, which focused on immediate or type 1 hypersensitivity. If you have any questions, you can bring them up in class. So in summary, in this talk we looked at type 1 hypersensitivity, and in the following lectures we look at the other 3 types of hypersensitivity reaction. Thank you very much.